Try me, this one, Suman is talking, no? Oh, she has come with the baby, so cute. She is a non-working mother. So cute. He is the chief guest of the day.
फोन पे कोई कनेक्टेड तो नहीं है ना, किसी का ऑन है तभी को आ रहा है, प्लीज चेक। एक मिनट रुको।
Any mobile is on? Any of the
Any of you have logged in from the mobile? Because the echo is coming.
20 मिनट से दे देंगे।
Maybe from laptop and here.
लैपटॉप की क्रॉस किए हैं, लैपटॉप क्रॉस किया है, माइक क्रॉस किया है। एक लैपटॉप का दे देंगे, लैपटॉप से है ना, लैपटॉप से दे देंगे फटाफट। हेलो हेलो, ठीक है, हेलो, ओके, ठीक।
Mothers and babies form an inseparable biological and social unit. The nutrition and development of one cannot be divorced from the nutrition and development of the other, says World Health Organization.
breast milk each day keeps the doctor away. So good morning all. Let's start the day's celebration.
Before we commence towards the proceedings of the day, let's seek blessings of the Almighty. May I request? May I, re- may I request Miss Momoy, our post-basic BSc Nursing second year student, to please come and take us to the Almighty. Vandana Harisha Dima. स्वर की देवी संगीत तुझसे हर शब्द तेरा वह हर गीत तुझसे तू स्वर की देवी है संगीत तुझसे हर शब्द तेरा वह हर गीत तुझसे हम हैं अकेले हम हैं अधूरे हम हैं अकेले हम हैं अधूरे तेरी शरण में हमें प्यार दीना तेरी शरण में हमें प्यार दीना मुनियों ने समझी है गुनियों ने जानी, वेदों की भाषा पुराणों की बानी। मुनियों ने समझी है गुनियों ने जानी, वेदों की भाषा पुराणों की बानी। हम भी तो समझे, हम भी तो जाने, हम भी तो समझे, हम भी तो जाने, विद्या का हमको अधिकार दे माँ, विद्या का हमको अधिकार दे माँ, हे शारदे माँ।
Now, I would like to invite Mrs. Cecilia, Associate Professor of our College of Nursing, AIIMS, New Delhi, for the welcome address.
A very good morning, one and all. As we have gathered here to celebrate World Breastfeeding Week, I deem it my pride to welcome you all. Nature has gifted every woman for to nurture her own baby. Breastfeeding gives the best feeding. First and foremost, I would like to welcome the chief guest of the day, Dr. Anu Sachdeva, Associate Professor, Department of Pediatrics, for the day's events. A warm welcome to our dynamic leader and the mastermind behind the day's events, Dr. Lata Venkatesan, Professor cum Principal, College of Nursing, for the day's celebrations. A hearty welcome to the esteemed faculty, College of Nursing, and the organizers of the day. A warm note of welcome to all the participants, students both online and offline, for the day's events. Once again, a warm welcome to one and all.
It gives me immense pleasure in introducing to you the organizing chairperson of this program, Dr. Lata Venkatesan, Professor cum Principal of College of Nursing, AIIMS, New Delhi. Ma'am is a passionate teacher, a distinguished researcher with many publications in the national and international journals, authored many books in nursing, and NABH assessor. Ma'am is always a mastermind behind all initiatives by the College of Nursing. She's an epitome of knowledge, a visionary, and inspiration to all of us. I welcome Ma'am to unfold the theme of today's program.
Good morning, everyone. Good morning, everyone. College of Nursing is observing the World Breastfeeding Week along with Department of Neonatology in AIIMS, New Delhi. Every year, August 1st to 7th, 1 week is observed as World Breastfeeding Week. And many organizations host different kinds of activities and programs to gain importance to this important aspect of life, that is breastfeeding. And we know the importance of breastfeeding, advantages of breastfeeding. In spite of that, where do we stand in breastfeeding is the question to be answered. With this question in mind, few months before, we conducted lactation management program in which 160 nurses working in AIIMS, uh, main AIIMS, Balabgar and Dayalpur were trained to create an awareness program that it is purely the nurse's responsibility to initiate breastfeeding within hospital settings. The latest guidelines says that irrespective of whether the mother is delivering vaginally or by cesarean section, the breastfeeding should be initiated within 1 hour of birth. And interestingly, if you look at the National Family Health Survey report, which was published in 2016, initiation of breastfeeding in Indian hospitals was only 40%. And in the year 2021, after 5 years, the fifth report was published by National Family Health Survey. And to our surprise, the percentage of initiation of breastfeeding has not improved. It has improved only around 4%. And on an average, it is only 41.4%. So over a period of 5 years, we were able to make only 1.4 percentage improvement. And as we say, if a patient develops bed sore, it is the nurse's responsibility to prevent bed sore. I would say that if a baby is not initiated breastfeeding within 1 hour, it is purely the responsibility of nurses, and we have to take the ownership for the reasons for which we were not able to initiate the breastfeeding. So this kind of awareness have to be created among all the nurses, especially those who are working in labor room and those who are assisting for cesarean section in the operation theaters, have to be given this key performance indicator of initiating breastfeeding within 1 hour of birth. So if that is done, I think we will be reaching a great rate of success and laying foundation for the newborn. But of course, the preparation has to start much before. Antenatally itself, the woman must be prepared for breastfeeding. When a mother comes for antenatal checkup, usually our concentration is on the antenatal palpation, on the abdomen, calculating the gestational age, and looking for fetal well being. This is the primary focus. And if every person who is involved in antenatal examination, let it be nurses or doctors, if we start examining the breast, if we do a thorough examination of the breast, many of the problems associated with the nipples can be corrected, because mothers have inverted nipples, and that can be corrected if antenatally if they start doing the exercises, so that they will be prepared to feed the baby during delivery. In my experience, I have seen only after the baby is born, we will put the baby to the breast. That is when the inverted nipple is being recognized. But it is too late. Then we try to pull the nipple with the syringe. We try to do this, that, but it becomes a failure, and artificial feedings are started. And once we start the artificial feeding, the baby as well as the mother understands there is something else available so that my baby can survive, and they start depending upon this artificial feeding. Once you start, then it is difficult to make them withdraw from giving the artificial feeds. So not even one artificial feed should be given. That is also one of the target which we have to take. If once given, it is gone. Even for me, my personal experience, if I have to share, after I delivered by cesarean section, and my baby was brought to me after 2 or 3 hours only. And meanwhile, she was given some feed in the nursery, and she was going on crying. And how many hours to breastfeed? Support is required. Even my specialty is OB-GYN, and I know I have educated many mothers about breastfeeding, but still, I was looking for whether the baby can be given an artificial feed. I could not sustain feeding her for a longer time. So now, when I educate the mothers, I say, even if the baby is latching to the breast 24 hours, allow the baby to get latched on, because we have no other work in the postnatal period. Our only primary work is breastfeeding the newborn. So we are carried away with myths and facts that you have to feed for half an hour, you feed 20 minutes in this breast, that breast, and you burp the baby. All these timings do not work out with every child, because the child clings on to the mother not only for getting the feed, it wants the comfort, it wants the security feeling. So it wants to get latched on to the breast of the mother. I think that should be encouraged, irrespective of looking at whether the tummy is full, whether my baby is getting adequate nutrition, whether baby is uh, still hungry. Those worries have to be removed. As long as let the baby decide how many hours to get latched on to the breast. And mother's duty is just giving her breast as and when the baby requires. And how long to breastfeed also. Earlier, I have seen when I was small, one boy, he was studying in first standard. During the break time, he will run and come home and have the breastfeeding and go. No, there has been provision for breastfeeding. You see a breastfeeding room in the airport, and in Tamil Nadu, there is a breastfeeding room in every bus stand. So bus stand also people wait, and they travel overnight long distances. So this kind of initiatives are also supporting breastfeeding. And once this breastfeeding is done, we are supposed to reach the sustainable development goals by 2030. There are 17 goals which are being given by the UN to be achieved by 2030. And surprisingly, when I saw the some slides I saw which is linking breastfeeding with all these sustainable development goals, all the 17 goals can be achieved if the breastfeeding is done, like even reducing poverty. Breastfeeding is available free and you can give good nutrition, so it reduces poverty. And everywhere all the goals are linked with breastfeeding. So this is such an important aspect that we strengthen and promote breastfeeding. And we are also wanting to do a study here and improve the breastfeeding initiation of India. It is supporting safe motherhood initiatives. In that, what strategy they have followed is they have listened to the women what they want. They have included 335,000 women from all the states, from different districts, from different categories, and mothers with different kinds of experience, like a primary mother, multi mother, mother who delivered vaginally and by cesarean section, mother of twin babies, mother of preterm babies. And they all will be sharing how successful they were in breastfeeding, or what are all the challenges they came across, and what was the alternatives they took, what was the kind of family support they had, what was the kind of support from the healthcare personnel they have received. All those will be explored, and we want to empower the students to gain the skills of leading a discussion. So our MSc nursing pediatric students will be doing it. And I must be thankful to Dr. Anu Sachdeva, because whenever we approach her, she immediately consents to support our program and encourages us to host the program. So she will be there assisting and guiding the students to moderate the session with the mothers and explore the realities of breastfeeding. And I'm thankful to Department of Obstetrics and Gynecology Nursing, though we do not have a department, but the faculty with the specialty of obstetric and gynec nursing and the pediatric nursing department have taken the initiative to organize this event, as well as the theme of the year is educate and support. So the pediatric nursing department has taken the initiative to set up a stall in the OPD, and they will be educating the mothers, whoever is visiting the OPD. Ms. Levis has taken the initiative, and she will be involved, and of course all the faculty will be involved. And this particular program was efforts were taken by Miss Cecilia Mary. She did all the organizing aspects along with Manita and faculty from OBG nursing like Rachel, Sri Sumati. All of them have taken the efforts to host this program. I am thankful to the faculty. Once again, the students will be listening and you will be benefiting. Apart from listening to how to improve breastfeeding, you also have to learn different methods of organizing the program. Every time having webinars are not interesting anymore, because the information is available. Whatever we listen, we may forget over a period of time. But these kind of practical interactive sessions will be helpful for you to learn the concept better and design strategies to help the women. Thank you very much.
Thank you so much, ma'am, for your thought-provoking and enlightening words. It is my proud privilege to welcome and introduce the guest of honor, Dr. Anu Sachdeva, Associate Professor, Pediatrics Department, AIIMS. Dr. Anu is a passionate teacher with much interest in educating the nurses in order to improve the quality care received by the newborns. She has steered the development of multimodal education package on preterm baby care for the prevention of retinopathy of prematurity for the neonatologists and the nurses of our country. Madam has made herself available in spite of her busy schedule. Dr. Anu, on behalf of the team, it's my privilege to welcome you. Ma'am, please.
Yeah.
Uh, Very good morning, all of you. First of all, thank you to Principal Ma'am for having given me the privilege to come and speak on something which is very close to my heart, being a mother, being an educationist, being a neonatologist. And thank you to Cecilia Madam Levis, who have, and obviously Kritika and uh, Deepika. So they were, I mean, they were so eager. Yesterday we had a meeting, though I was on leave, and we planned how will we go about the focus group discussion. So hats off to your team, madam, and they're always very forthcoming and ready to stand, and we are ready to venture out, doing new things and working out different programs to help benefit both the healthcare professionals, help benefit the students, and we are always available for all good venture that you take in the future also. So having said that, so, as Madam said, the theme is step up education, step up the support for all the mothers who have the intention to breastfeed, who are wanting to breastfeed. So, we are here for discussing the needful. So, if you look at this slide, and this is the most interesting phenomenon that you would observe. So, on the top is antibiotics for preterm premature rupture of membrane. So, left hand side, the y-axis lists all the interventions which can decrease under 5 child deaths. So look from the top to the bottom, and I read it out for you. Antimalarials for mothers, measles vaccines for the children, nevirapine, HIV positive mothers, newborn hypothermia management, tetanus toxoid to the children, vitamin A, damn it, hand hygiene, water, sanitation, zinc, complementary feeding, and the lower purple line actually goes on to almost 13%. So the single most important intervention, if given universal coverage, and when I say breastfeeding, I mean exclusive breastfeeding for 6 months and add on continued breastfeeding up till infancy. So up till at least 11 to 12 months of age. So 13% reduction under 5 mortality. What more do you want from any intervention? There are millions of interventions which are available. This breastfeeding is the single most important intervention which decreases under 5 child mortality, and this is the magnitude of breastfeeding. So why are we here talking about breastfeeding, breastfeeding, breastfeeding? Remember, a normal newborn, 4 months doubles the weight. So 2.5 kg at birth, 5 kg at 4 months. So immense increase in growth. Brain growth is maximum in this period in the first 6 months. The gut is establishing its microbiome. The requirements are many. So breastfeed actually comes as the supply demand for the newborn during the first 6 months. Good amount of oligosaccharides. It is specific to humans. It is species specific. So sometimes in the ward, a mother would ask me, Doctor, can't I give just one cow milk feeding to the baby? So what we tell her is, cow milk is meant for the babies of the cow. This baby wants your milk. It is species specific. Please go ahead. It's not about 1 or 2 night feeds per day. It is about complete exclusive breastfeeding. If you talk about the consequence of breastfeeding, good amount of lactase, and the baby can digest that lactase easily. Very good amount of whey, which is again very easily digestible. The fat globules are immense in phospholipids, again better absorption, better digestion. Having said that, so nutritive benefits are many. This is the non-nutritive benefits which you see on the slide. 15 times reduction in mortality for babies till the age of 6 months. All cause mortality. So all cause mortality decreases even beyond 6 months. So 2 times less risk of dying if I feed my baby beyond 6 months as well. Not because of pneumonia and diarrhea. Yes, it is there. Pneumonia mortality decreases by about 1/3. Diarrhea, half the episodes of diarrhea are there in babies who are breastfed. Mothers who actually resort to formula feeding are actually with their baby, coming to the hospital, going back, pneumonia, diarrhea, cough, loose stools. So it decreases infection related hospitalizations to a significant extent. Not only this, even beyond infancy, right up to adolescence and beyond. Less overweight, so these babies are much more healthy, less obesity, less risk of diabetes. Interestingly, the IQ in babies who are breastfed is 3 points more as compared to the formula fed babies. So why would any mother, if she knows these advantages, not be ready to breastfeed? In addition to that, mother has immense benefits: decreased psychosis, decreased postpartum hemorrhage, decreased breast cancer, and decreased ovarian cancer. It is completely environmental friendly, and there is decreased expenditure by the nation on breast milk. And why is it environmental friendly? Is to make 1 kilo of milk powder, I need to waste 4,700 liters of water. Imagine the magnitude. And if this is a study from the UK, if the mothers were exclusively breastfeeding for 6 months, it would actually amount to less fuel emission by 55,000 to 70,000 cars on the road in 1 year. That is the amount of carbon dioxide emission which is happening if you formula feed your babies. So we are all conscious individuals. Our duty, our moral is actually to help the mother know these benefits. And here comes in the question of how do we optimize it? Education, yes, it is important. Also stress the role of birth companion. Do not routinely keep on going and suctioning the mouth because there are some secretions. Only visible secretions are there, suction. The moment the baby is born, put the baby on immediate skin to skin contact. Promote frequent feeding. This will promote reflexes, promote rooming in with the mother, promote that the baby and the mother stay in the same bed. So, bedding in. No pacifiers, no janamhutis, no honey, no pre-lactal feeds to be given. Assess lactation. You are the champions. You visit the mothers, assist till until and unless you actually see a mother breastfeeding the baby, reinforce the positioning, reinforce the attachment. Don't leave the postnatal ward till you have actually seen it. Tell her to completely empty the breast and tell her to give on-demand feeding. This I'm talking about a normal baby. So ये नहीं कि every 2 hours वो लगा ही रही है. Ma'am rightly said, let the baby be. Let the baby take the feed whenever the baby wants. Nothing will happen in a normal newborn, right? So promote that these mothers exclusively breastfeed for 6 months and even beyond that, up till 2 years at least. So let us see some normal chit chat scenarios. So what are these scenarios? So before joining work, we all are working mothers who have already breastfed our babies. So mothers should learn to express breast milk, and this will help her to maintain a good sufficient supply of breast milk round the clock. A few days before returning to work, the baby can be trained to take that express breast milk with the help of a katori spoon or a small glass. So after joining work, before you leave, breastfeed the baby. Again, when you come back, again breastfeed. Night time, breastfeed the baby as many times as the baby wants. Some working institutes also have creche facilities right there. And many private institutions are actually now it's becoming compulsory to have a creche facility within your new established institutions. The express milk that she uses that can be kept at room temperature for 6 hours and in the refrigerator for 24 hours. Take it out, thaw it, and then feed the baby. So any caretaker at home can do this. So this is, and we'll actually hear in the focus group discussion, football position means holding both the babies and helping the mother to breastfeed them simultaneously. So we'll ask, we have a mother who delivered twins, we'll ask that how was she actually managing. Sometimes both the babies would cry simultaneously. Instead of feeling helpless, help the mother to actually breastfeed the baby simultaneously. These are some myths. If my baby has jaundice, I should not breastfeed. If I have hepatitis B, I should not breastfeed. If I have CMV, I should not breastfeed. Mother is a chronic smoker. She will actually give passive smoking to the baby. No ways. These are not the contraindications for breastfeeding. Mothers who are hepatitis B positive, just give vaccine and immunoglobulin to the baby, and baby should be exclusively breastfed. So these are not the contraindications for breastfeeding. HIV, we will promote breastfeeding unless and until mother does not want to take even that 0.03% risk. Remember, if the mother is receiving complete antiretroviral therapy, baby is receiving zidovudine and nevirapine, the chances that the baby will actually have HIV infection are very, very less. And see the benefits. No diarrhea, no pneumonia, no hospital admissions, no mortality. So the benefits outweigh the risks of HIV transmission. So all mothers with HIV positive should be exclusively breastfed unless and until they voluntarily do not want to do so. Mothers with tuberculosis, they can be exclusively breastfed. Hepatitis B and C, CMV, they have to be breastfed. Preterm babies, sometimes we do reconsider our decision for CMV positivity, but that is not the acute concern for the day.
These are some of the drugs. Just remember, if the mother is on chemotherapy for some cancer, only then breastfeeding is contraindicated. Practically, for other purposes, you have to give breastfeeding. So this is something which is important. So the grandmothers would say, "ये पीला पीला शुरू में क्या आ रहा है? Discard the colostrum." No, colostrum is essential. The grandmothers would again say, "Now, all offences are submitted." And even some other mothers would say that mother को बहुत ज़्यादा घी खिलाना चाहिए. You should actually give large amount of ghee to the mothers, which can actually increase the baby's weight. No. Protein rich, good nutritious diet is more than enough. Give good proteins, good green leaf vegetables. Ghee is not to be given. Mothers have a preoccupation. If I breastfeed, I'll lose my figure. On the other hand, your tummy gets inside and you actually come back into shape much more faster if you breastfeed your newborn babies. Mother is ill, she's having fever, don't breastfeed. No. Mother can continue to breastfeed even if she is slightly having fever. Of course, if she's very sick, she's hospitalized, there are other reasons. So give more milk to the mother, only then she will produce more milk. No. Hydration is important. Even if you don't give, if you give 500 ml of milk and don't give 800 ml of milk, it is not related. But mother's hydration, good nutritious diet should be given. Mother is very thin and lean. Her breasts are very small, so she cannot produce good milk. Please remember, a fat mother or a mother with bulky breasts has more fat content, but it does not depend upon the fat content how much milk will be produced. Small alveoli are there, which are in sufficient number even in mothers with small breasts. They can produce a good amount of milk. The important funny thing is, I could not feed my first baby, so I'll not be able to feed this baby also. No, she can definitely be successful if we are there to support her and to help her out in breastfeeding. So these are the 10 steps we'll see on the stall, and these are some things that the hospital should be promoting rigorously to ensure that breastfeeding is done. So these are some interesting facts. So it's very sad that only about 40% of the LMIC babies are being breastfed at 6 months. The quantum is that less than 5 years, 8 lakh 23,000 deaths in children can be averted, and 20,000 annual deaths from breast cancer can be averted. That is all for the day. Just food for thought. So think about it. We should become strong advocates, strong promoters, and help while we are on the floor and off the floor to breastfeed mothers and take our nation to the next step. Thank you. Thank you so much, Dr. Anu, for those enlightening words and provoking thoughts. And we really feel privileged to have you backing us all the time. Moving on to our very interesting section of today's program is the focus group discussion. So before we start with the focus group discussion, I would like to read out a poem written on breastfeeding by Gemma McNally. It's one of the most natural things to do, but no one tells you the toil it can take you on. In the early days, it's so painful and sore, and you just don't want to feed anymore. The cluster feeds to help build your supply means you have to kiss your night sleeps a goodbye. When you feel like a 24/7 milking machine, and every latch on just makes you want to scream. It's a learning process for baby and you, while you both figure out what you're supposed to do. But it's an act of which you'll grow on very fond because it sparks such a wonderful mother and baby bond. Those little moments of quiet amidst the busy day are a chance to connect with your baby in a very special way. As they get older and feeding is less and less, the fact that we have made it this far makes me feel very blessed. When my nursing journey comes to an end, I'll know I'll shed a few tears, but I'll be so proud to know that I gave them the best start to their early years. So these were the words of one of the mothers. Now we have a few mothers with us who have experienced breastfeeding, the challenges they faced, all those things. So it's time for me to hand over the session to them. So in order to moderate, I would like to welcome Ms. Deepika and Ms. Kritika, MSc Nursing second year students, to lead the session.
Thank you, ma'am. A very warm good morning to Honorable Principal, ma'am, respected dignitaries, faculty members, mothers, and online participants, and my dear friends. We, Pritika and Deepika, students of MSc Nursing second year, are here to moderate this informative session in which mothers will share their experiences about breastfeeding. And we are starting this session with a beautiful quote that breastfeeding is empowering. It's an accomplishment that takes dedication. Now I request to all the mothers to please be seated here so we can start the discussion.
Nicu Sachdeva.
I also request to Ms. Cecilia ma'am and Dr. Anu ma'am to please come in front so they can guide us in this field. Being a mother for the first time is always special and challenging. So I invite Ms. Suman. She is faculty in College of Nursing, AIIMS, New Delhi. So ma'am, as you are premi-level mother, can you please tell us how did you feel on the first day after delivery when you are blessed with your first baby? And what all are your apprehensions?
So when I was delivered, I was very excited that I will be able to take care of my baby very nicely. So I delivered and I was excited to see my baby, how she is, to whom she resemble. I want to see her again and again. And after some time she was shifted towards my side. My breastfeeding initiation was also started soon after the delivery, though it was a lower LSCS, but it was started. But in the morning, my baby developed respiratory distress or TTNB. So the baby was shifted to neonatal ICU. But breastfeeding at the time was initiated, and I was able to. At the time, I was not able to produce that much milk. But so and after the Nicu period, my baby was very 2 days. The baby was recovered, and initiation was started. Init- I didn't face any problem because I was knowing about the attachment and positioning, so I didn't face problem during the initiation of breastfeeding. And in this period, nicotine and the nurses helped me a lot to express and other things. They supported me very well. Uh, this early diagnosis of TTNB, because they used to watch the baby regularly. So it was early identified and the baby was shifted very promptly to neonatal ICU and good care was provided to my baby.
Thank you, ma'am. Can you please tell us your experience when you breastfed your baby for the very first time?
So at the time I was feeling happy. Matlab, before that, my baby was, matlab, I was just thinking when my baby will come near to me. And when I first time breastfed my baby, I feel really good. And as I told, I didn't face so much problem regarding attachment and positioning. So I feel very good that at least I can give something to my baby directly. I feel good.
And can you share your opinion about colostrum? Like, should it be used or should it be discarded? And what can be the advantage?
Colostrum is very good for the baby, and uh, they have antibodies that will prevent the baby from the diseases, and it is very good for the baby. So I didn't waste even a single drop of the colostrum. I give it to my baby.
Thank you, ma'am.
I want to add on the things. In the till the time I was in hospital, I was very much uh, uh, helped by the team. But when I went to home, I faced lots of problem uh, before breastfeeding, because all the attention that was before delivery, that was on me, but after delivery the focus was only on the baby, and I was somewhere neglected. I was thinking that all the focus is on the baby, and I was so tired. I feel so tired, and I feel drained sometimes. Like over the for the whole night, I just wake up, and then when the baby will sleep, the baby will sleep in the morning, and totally feel drained. But at the time, I console myself that this is the period. I need to be very much strong, and it will pass on. But it will pass on, and I successfully completed 6 months of exclusive breastfeeding to my baby. Not even any single drop of that. And for that, I want to tell that I face so much problem. From the elder member in the family, they used to tell that हमने भी अपने बच्चे को पाला है, और हम तो दे देते थे। तो इसमें तो कोई प्रॉब्लम नहीं है, मुगली घुट्टी तो दे ही सकते हैं, इसमें तो हम भी देते थे। देन आई said no, I will not give anything to my baby. This breast milk is sufficient for my baby. I will give only breast milk till 6 months, and I feel proud that I give breastfeeding to my baby till 6 months.
So I think that was a very good gesture, Suman, that you actually were bent upon that I have to breastfeed my baby 6 months. So three clear-cut messages which come out after we discuss. Number one, colostrum is the key. So the and the second thing is what you did was early initiation of breastfeeding. So with your case, the good part was that you already had some idea of how to hold the baby, how will the baby attach. So many mothers may not have that education or may not have that information or knowledge with them. So I think when we open our booth and we would have some demonstrations and we would help the mothers out for that. And material is available. The only thing is that you have to take it to the mother and demonstrate it to her that yes, this is the way. So one key thing, colostrum is very important. Second key thing is determination. So mothers do feel emotionally, physically they are drained. Imagine 9 months you're carrying the baby and then the baby comes out and then the baby would sleep and the baby would want to sleep, but there would be expectation from the family that now the baby has slept, now you can help in this or you can help in this. They don't understand the cycle. They have themselves been the mothers and the fathers, but then yeah, so the baby is also agreeing that you're telling the truth. Yes, so the baby somehow seem to understand you very well, and I think that might be a fact for all the mothers. The baby would sleep, and then mother should catch up rest the moment the baby is sleeping. Just forget about everything. So then mother has to be determined for breastfeeding. Don't discard the colostrum. And once you are determined, the baby would anyways cooperate with you. And being the baby has been with you 9 months more than anybody else in the family has been the baby with. So then the baby would always cooperate. So then you can carry on the journey of breastfeeding. So we take two messages. Colostrum is very important. Do not discard and exclusively breastfeed your baby for 6 months. Yeah. Thank you so much.
Thank you, ma'am. Thank you, Ms. Suman, for sharing your deeply personal experience with us and how bravely you deal with that problems and how you stressed on the importance of breast milk. So today we have a mother with us who recently delivered the twins. And along with her personal life, she's also focused on her personal professional goals. As she's a student, as she's a student of post-basic BSc nursing in AIIMS, she is so determined for her goals that just few days after delivering twins, she joined the course and did not take leave. So this is really great and inspiring and encouraging for all of us. So we can give a clap. So you can be a good mother and still follow your dreams. So Miss Marina, please tell us how you managed to breastfeed your twins and what all are your breastfeeding experiences when you are dealing with the breastfeeding your twins.
Hello everyone. Uh, for my twins, I already had experience from my first baby, my daughter. So actually, for the attachment and positioning, I did not face any problem, and I was already prepared for that, like with the positioning of twins and all. But the issue was the baby was 2.4 kgs and 36, 37 weeks. So when we study about the twin positioning, in practical, for me, it was not convenient. Like we have the football positioning or double cradle positioning. For me, I found that the babies, they were like for attaching to the nipple in the first few weeks, they were not strong enough. It will slip out after a few seconds. So I have to hold my breast and put it in the mouth. So in the first few weeks, I have to feed them one by one, not together. But after some maybe 3 weeks, 2 to 3 weeks after that, the second baby, the second twin, he was able to grip firmly once the nipple is placed on his mouth. But the first twin, he had some more time, like he needed more time to catch up to that. But after that, I used to use the position on the left side. I will be using the football method, and the right in the cradle method. So it was convenient for me to fit them in that kind of position.
Thank you, Ms. Nanda. Next question to you is how your family and partner supported you during that period, because that is also some great deal, that how your family is supporting you during that
Yes. So because we already knew that I was going to have twin babies, so my parents they came up for helping. My husband he was there, and one cousin. She just gave her exam. She was free, so she came up to help. So all the household work was divided among them, and I was like my responsibility was only to breastfeed, eat, and rest whenever the baby was sleeping. The babies are sleeping. So for me, I was really lucky that my parents, my partner, and my cousin was there to help me out. And especially for me, what happened was, as you all know, that babies they have different sleeping timing. So my partner he used to stay awake till 2:30, 3 a.m. and all the late night nappy changes. And sometimes even if the baby's stomach is full and even if the nappies are dry, they are awake. They want to be carried in the arms. So he used to do that work, and he will let me sleep by 11, 11:30, and I'll be the one waking up at in the morning like 5 a.m. and all. So we used to shuffle the timing. So in that way, I used to get rest. But it's, every mother know that that rest is not sufficient because babies, the timings are different. And with me, twins, one will be sleeping, one will be awake. So it was very difficult to coordinate with the rest timing also.
Okay, Ms. Narina. So, as we also said that you joined the course very early and you did not take the lead. So, your husband and family, how they supported you how they motivated you to join the course, and at that time, how you are breastfeeding because you are coming to the college and doing all work. So, how you are managing to breastfeed your twins at that time?
Yeah, yes. For me, I felt that communication was the key. So before starting my college, I mean, even before delivery, regarding my exams and all, I communicated with my family members, and then that way we planned that what who will do what and all these things. Other than that, once the college resumed, then what was the question?
How did you
Then,
manage
how do you
your
manage to
Yes,
breastfeed them?
yes.
exclusive
So
breastfeeding?
yes,
How did you manage?
so in the night and before leaving, I used to breastfeed. Then, because the classes was from 9 to 1, and sometimes it will finish a little bit early. So I used to go home during the break. Then 2 to 5. Then sometimes I used to uh, come back after lunch and then again attend class and go back home. That was during the CHO program. But yesterday we started our clinical. So yesterday was my first day. So I left in the morning, 7:20 from home. So I came back home at around 1 p.m. for breastfeeding. So here my question to ma'am and also the other organizing members. Actually, I had this dilemma because I know that I have to give exclusive breastfeeding, and for my first baby, it was 6 months exclusive breastfeeding. And this time I had the dilemma, like I felt I could not do that, and even I had a discussion with my other friends who had twins and who were working in private sectors because they get only 3 months of maternity. So I was asking them how you manage, and we already also had that option of expressing and then storing and giving. But ma'am, actually, it was not sufficient for the baby because when we express and when they take direct breastfeeding, it is very different. I mean, the amount, the quantity, everything, it makes a difference. And then even if you express 30 ml, and especially for my babies, 30 is not enough. Like that is just the thing, no, like minimum, yes. So at least they need when they take direct breastfeeding, at least 20 minutes, sometimes even 30 minutes, and their appetite is so good. Like even sometimes one baby will take both the breast and still they will be like asking for that. And I'm happy because their weight gain is also good. So, ma'am, like, how do we fulfill that exclusive breastfeeding goal? Because in my case, I've started thinking maybe I need to give at least one or time of formula feeding during that period when I'm at work, because we cannot sustain 4 to 3 to 4 hours of without breast milk. When I'm at home, I used to they used to ask for breast milk at least after 1 hour, or sometimes not even 1 hour, like maybe 40 minutes, 50 minutes. It's like that.
So, first of all, congratulations for having been able to sustain till now. So, hats off to you. And one thing is the same zeal and the same confidence which helped you to sustain the journey till date. The same zeal will carry you and exclusively help you to breastfeed your babies for 6 months. There are 2 or 3 things. One thing is that you need to eat very adequately proteins and green leafy vegetables so that you're able to sustain your breast milk production. Second thing is the second best alternative after direct exclusive breastfeeding is that you try and express milk as much as you can after. So maybe if you get up at around 5, after having breastfeed your babies around 6, is just before leaving, express as much as you can. Then while at work, maybe intermittently, you will have to arrange for something so that you can express or even discard the milk while at work, so that the 24-hour cycle of maintaining that adequate amount of production remains at go. So maybe that you express while you are here, and some family member, if you're staying nearby, can come and take the breast milk back and feed the babies if you're having that kind of strong family support. Otherwise, you may consider top feeding, but then when we meet after this session 1:1, we can discuss. But from my side, one goal is that you express breast milk, and that milk can be fed to your babies. You can keep it at room temperature for 6 hours. And if you think that your milk production is abundantly good and you can express while studying, maybe once you go to the washroom or the loo, 15 minutes, you can bring your breast pump and some family member can take back. You can refrigerate that milk for the next day or even the next day. You can do that. But that will be my one advice. Then you can give express breast milk to your babies. If that falls insufficient, there are some ways by which we can increase your breast milk if you're interested. If that also falls insufficient, then once a day, don't give it heavy on your mind. There are cases where twin mothers have exclusively breastfeed for 6 months, but in case things are getting a little difficult and you're not able to manage, yes, you can give one top feed, but that should be given very sparingly. Right? Thank you so much.
Thank you, Ms. Marina. So here we have seen that the family support system is also important for continuing exclusive breastfeeding. So thank you for discussing that and sharing your experiences. A mother thinks of her children day and night, even when they are not with her. Today we have Miss Sarita with us. She is nursing officer here in AIIMS. Now she will share how bravely she dealt with the challenges while her baby was in Nicu. So, ma'am, can you please tell us while your baby was in Nicu and you are just delivered the baby, what are your apprehensions regarding feeding the low birth weight baby?
I had my babies at 32 weeks. They both were 1.1 kg, one boy and one girl.
girl was better and boy had initially my breastfeed was not suitable for him. So the poor girl, she was tolerating well, but boy had vomiting and also he didn't tolerate with that. So he had sepsis and all on that time, and he started receiving my feed from fourth or sixth day onwards. Till that time, he had sepsis and uh, and they suspected meningitis too, and he had lumbar puncture and all. On the sixth day onward, he started tolerating my feed and he recovered very fastly after that. My girl child was tolerated my feed well and she recovered well, and on 10th day she came to my hand and I started caring her on my room, and baby boy stay on Nicu for around 50, 25 days on Nicu as he had sepsis and on continue IV injectables. And I think I had many issues for the feeding because they both were 1.1 kg and they can suck at that time, suck and even swallow. Though they both were on tube feeding on that time. From tube feeding also we used my milk with fortification. So after on tube feeding, we trained them for parada feeding using my milk, and on continuing Canada feeding, I trained to suck my milk to both of them. First, my baby girl learned, and baby boy take time to learn the sucking. And on uh, took around two and a half months for learning sucking. After for that 2.5 months, we couldn't take any break for anything because we have to feed them second hourly. So we have to express the milk and fortify them and sterilize all the instrument that we using for them because they are highly prone to be get infected. So we or the family, my husband, and my mother, we three were working continuously 24 hours to reach all this. Uh, on the 2.5 months, they both trained to suck the milk. By that time, we got relaxed that we reduced the work by that time. So I think
So, as your baby was low birth weight and such a long stay in Nicu, so when did you meet first time your baby?
on I had on the 24th. On the next day, I met them because I was shifted to a new private ward on the first day. They both were on Nicu A. So on the next morning, I took a wheelchair and went to meet them. Took 1 day for me.
Okay, so when you meet your baby, so was baby on is on oxygen or on room air?
They both were on CPAP.
So how hard it is for you to see, but how bravely you deal with those conditions, that is highly appreciated, and we should clap for. So when did you breastfeed your baby for the very first time independently? When did you breastfeed your baby
independently? It took 2.5 months for to suck them independently. It took that much time. They were not strong till that.
So as you told us, you used to express the breast milk for the baby. So how you used to express the milk? Like you are using the breast pump, or you are using you are used to express the milk by your hands, or how you are managing that?
First time I expressed with my hand, and after that the babies are on Nicu, and I used to went to Nicu and express milk on Nicu. There are very good pumps are there, and we got one pump for room purpose and all. So we used to pump when the babies are in Nicu. Sometime I used to express my milk on room, and somebody get that milk to Nicu. Or if I am able, I was used to go myself and express the milk. Or till the fourth day, somebody helped me to take the milk to Nicu. And the fourth day onwards, I started KMC for both babies. And on that day onwards, I used to express my milk on Nicu for them.
It is highly appreciated how you are interesting to give only breast milk to your baby, you are expressing, you are using breast pump and all alternatives so that you can provide the breastfeeding to your child. So, ma'am, you want to give any input?
What is the age of your babies now, sister?
They are 4 years now.
They are 4 years. So it looks like a memory, that the journey together. So hats off to you.
So I think very lot of hard work has gone into. And what was the time when they were born? What gestation system? 32 weeks. So small babies 1.1, 1.2. Here it brings us the importance of one, exclusivity of breastfeeding is important. And you give it for corrected 6 months, meaning that start from 40 weeks and 6 months after that, exclusive breastfeeding has to be given. Not postnatal age 6 months, meaning if they are born 2 months earlier, it's not that you stop breastfeeding 2 months earlier, you actually continue it 6 months beyond 40 weeks. So for her case, it would have been actually 8 months from the time of birth. That is one. Second thing is that the family support, and which also came us from the mother who was breastfeeding her twins and then joining work. Family support is something which is very, very important. So the family, the mother-in-law, the mother, the husband, the partner have to stand shoulder to shoulder. And actually, the entire benefit can come only when we are working as a team, as a unit, whether it is preterm, whether it is term, the mother needs continuous social, emotional, physical, food, everything has to be supported very well so that the country can actually reach the next level. Thank you so much.
Thank you, ma'am. Thank you, Ms. Sarita, for sharing your experience, how bravely you deal with all the problems, and how you are managing to breastfeeding your baby at that time. To be a mother, it's an exciting, exhausting, and emotional roller coaster. But that's life. And only a mother can tell us how it feels, as breastfeeding is a deeply personal experience. Today, we have Dr. Manju Rajora with us. She is faculty in College of Nursing, AIIMS, New Delhi. Ma'am, please tell us, as you are a working mother, what problems you face during breastfeeding.
Um, right now, see, my baby is going to be 3, and he still takes the breast milk whole night. After every half an hour or 45 minutes, he asks for boo boo. And morning, after getting up, he asks for boo boo 2 to 3 times. When I go home, then boo boo. So it's like a now it's kind of trauma, kind of torture to me. So because it pains me whenever he sucks now. And my other breast has, I think it has fibrous adenoma. So because of that, whenever he sucks, it pinches me. So I cannot feed from my right breast. So and from left breast, he keeps sucking. And when I tell him, baby, it hurts, mama. So he says, no, no, or nahi, nahi. I mean, he, of course, he doesn't understand this thing at this moment. Uh, so this time, this is a problem. And as a working mother.
Yes, ma'am. So, ma'am, how you're managing that thing, and how, as your child is continuously saying, and you are saying a no, 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 then also how?
It's like hopeless. Hopelessly, I'm managing. I'm too stressed, of course, between this professional work and personal thing. Hopelessly, I'm managing it. I
But
don't have any other option.
but till now you are continuing.
Yes,
that.
I am
So
continuing.
that is that should be appreciated. That till now, as she is also having such problems, and then also she is continuing. So that should be appreciated. So thank you, ma'am. So, ma'am, please tell our audience that how a mother can sustain breastfeeding in a better way.
See, I had immense family support until now. My husband, when he born as an IUGR baby, and he was 1.69. So my husband took complete responsibility for first 6 months because I was LSCS, and he used to go to nursery and he used to make the feeds. So the nurses would say, तुम्हारी family में कोई lady नहीं है, तुम आते हो. uh, One time, on one hand we say that the father should support, and on other hand the nurses are saying, why do you come, you don't have any lady in your family. So but and my mother-in-law used to have tears in her eyes when she used to see me, because I had breast involvement, heavy breast involvement, and sore nipples. And he would, whenever he would suck, he would bite. and I don't know what was it, and it was so much painful that I used to cry to the hell, and even the neighborhood people will know that something is happening to this mother. It's so painful, but they took care of me very nicely, and that was very I mean, family support is immense, I suppose, and your own determination and your knowledge. If you have knowledge that if you feed your breast baby exclusively for 6 months, then of course you can maintain this. But if the mothers don't have knowledge, I used to go to the center. I mean, the 1 week after the discharge, they call us to some neonatology center for practicing milk breastfeeding. So mothers used to come. They say that milk doesn't come, and I'm feeding my baby mother dairy milk, cow's milk, that milk, that milk, or janam ghuti. So they didn't have knowledge. I think knowledge is very important, and this what you are doing, it's very appreciable that you have realized that prenatally this knowledge should be given. It is commendable. I wanted this to happen, and it's happening. It's really appreciable, I suppose.
Thank you, ma'am. So, now I request Dr. Anu, ma'am, please give some input that how we can manage such problems
And one more thing I would like to add, Dr. Anu came as a angel for me when I was having heavy breast engorgement, and I was in tears. She really helped me a lot. And there were two residents who came 2 times, but they expressed something. I was calling to the help. Unfortunately, nurses, they didn't come to me and they didn't help me. But when I went to the center, there was a nurse that was a post basic student of ours, and she was really helpful to me. I would say it's not about nurses or doctors, it's about human beings. They understand the mother's situation. It's not about the professional, it's about the individual. And she realized, or those two residents realized, or that one post basic student realized a mother's dilemma, issues, concerns. And I'm really thankful to you.
So I'm actually happy that we've been able to make some difference. But one personal request, you can start weaning off your baby of breastfeeding because after about 2 years, what happens is the breast milk is more like an emotional support now. So the content is not that enough that it should be actually a nutritional support for your baby. So you can come to me for that and I'll tell you the ways and means to actually make him busy with other things. So your husband will be very good in that. So in the night, one small piece of advice, avoid sleeping with him in the initial part. And when he gets up, father should be there. Mama is gone, mama will come back early in the morning. So start increasing those 40 minutes to about 2-3 hours and then gradually wean him off so that he will feel much more independent. Otherwise, he'll be always clinging on to you. So this is the time when he should start exploring and he should start going around. Otherwise, he'll remain mama's baby. I mean, you can always do that. You love to do that. But then it's time to start weaning. And the second thing is that Dr. Manju actually told us that it is overwhelming experience, especially for working mothers who are like, they are used to this routine ki 7:20, 8 o'clock घर से निकल जाना है. 5 o'clock तक you're working as a professional, you're working as a teacher, educationist. And then after breastfeeding, you start, the baby is born, and everybody thinks that it's actually natural. The same as Suman said, कि बच्चा becomes the focus. ठीक है ना डिलीवर कर दिया जैसे हमने किया 6 months के बाद, you will also be fine. But please, it's an overwhelming experience for the mother. And we actually saw that Dr. Manju lived that experience while she was talking to us. It is very, very traumatizing. The whole night you remain awake. And after that, when you join back to work, you're expected to perform 100%. There are no escapes. At 8 o'clock lecture, I could not attend because I was breastfeeding till 5 o'clock in the morning. No ways. But then the family support becomes handy. And once the partner is standing, or the in-laws, or the mother is standing with you, difficulty will actually pass off like a phase in the life. So hats off to her, and I think she has actually lived her experience while talking to us. So we can actually understand through her feelings that what actually a mother goes through. And she's absolutely right that that one person or two persons can actually make the difference at that point of time. So let us become those angels who can actually help mothers through this period of crisis. Thank you. Thank you, ma'am. So from here, you should also be able to understand that being a nurse or being a doctor, that is not. Firstly, you have to be a good human being with a golden heart. So you have to feel what the mother is going through, and what are the requirements of a baby. So after that only you will get you will know what is the importance of breastfeeding the child. And also you have to focus on the mother also, because she's also going through so many lot of problems are there. So you have to support her, and also along with that spread the knowledge regarding breastfeeding, so that will help to solve these problems. Thank you, ma'am.
I want to say, being a homemaker and a mother at the same time is the biggest job in this world. As she is a mother, she is a daughter, she is a wife, and she is more of that, she is a person. So आज हमारे साथ मिस सोनिया है, तो मैं उनसे रिक्वेस्ट करूंगी कि वो हमें अपने ब्रेस्ट फीडिंग एक्सपीरियंस के बारे में बताएं। जैसे कि आपका बच्चा अभी 6 महीने का है, तो आप कब तक सोच रहे हैं कि आप कब तक उसे ब्रेस्ट फीड करवाएंगी या अभी करवाना बंद कर देंगी? आपने क्या क्या कहना चाहेंगे इस पर?
मैं बहुत खुश हूँ कि मेरा बेटा अभी मेरे ब्रेस्ट फीडिंग ले रहा है, और मैं चाहती हूँ कि वो कम से कम ले तो 4-5 साल तक ले, क्योंकि जितना हो सके दूँ मैं। पर अभी तो वो बहुत अच्छा है, उसको कोई दिक्कत नहीं है। और 6 महीने तक मेरी जो पहली बेटी थी, उसको कोई भी प्रॉब्लम नहीं हुई थी, नहीं जुकाम, नहीं कफ, कुछ भी नहीं था उसको, और वो ठीक थी। और अभी डुगू भी ऐसे ही है, उसको कोई भी दिक्कत नहीं है, वो अच्छे से दूध लेता है और सोता है अच्छे से। तो ये मेरे लिए बहुत अच्छी बात है कि वो मेरा फीडिंग ले रहा है, क्योंकि कई माँ ऐसी है जो जिनके पास ये अपॉर्चुनिटी नहीं है कि वो फीडिंग करा सके, पर मेरे पास है। और मैं बहुत धन्यवाद देती हूँ कि हम लोग उसको, मतलब मैं दे सकती हूँ उसको फीडिंग के लिए।
जैसे आपने बताया कि आप अपने बच्चे को जितना ज्यादा हो सके आप उसे ब्रेस्ट फीड कराना चाहते हैं।
जी।
अभी आपका बच्चा 6 महीने का है, तो दूध के अलावा उसके साथ कुछ और खाना या कुछ आहार देने का के बारे में आप क्या कहना चाहेंगे?
नहीं मैम, अभी तो मैं कुछ नहीं दे रही उसको, और अब 6 महीने के बाद से स्टार्ट करते हैं, तो थोड़ा थोड़ा स्टार्ट करेंगे हम लोग। पर मैं अपना ब्रेस्ट मिल्क कंटिन्यू रखना चाहूंगी उसके लिए, क्योंकि वो सबसे ज्यादा अच्छा है।
तो आप जानती हैं कि ब्रेस्ट फीड करवाने के क्या क्या फायदे हो सकते हैं, या आप
बहुत
बताना चाहेंगे कि क्या फायदे होते हैं? क्या
बहुत कुछ ज्यादा तो नहीं जानते, पर ये है कि सबसे सुना है कि माँ का दूध सबसे ज्यादा अच्छा होता है, बच्चों के लिए हेल्दी करता है और बैक्टीरिया से बचा के रखता है। तो ये सब चीजें अच्छा है।
डॉक्टर अनु प्लीज।
तो सोनिया जी, बहुत अच्छा लगा जान के कि आप अपने बच्चे को 6 महीने एक्सक्लूसिवली ब्रेस्ट फीड कराने का
सोच रहे हैं। बहुत अच्छी बात है। और एडवांटेजेस हमने कितने बोले, जो भी बोला, बट एक जो मूल रूप से मैं कहना चाहूंगी, दूध कोई भी है वो बच्चे का पेट भर देगा, है ना। जैसे अब क्या बोलते हैं, आप डब्बे का दूध दे रहे हैं, गाय का दूध दे रहे हैं, पेट तो भर देगा, बट बच्चे का दिल सिर्फ माँ के दूध से भरता है ना। तो वो बिल्कुल आपकी स्माइल से पता ही लग गया कि मैंने तो कराना ही है, उसका हक है, मैं देना चाहती हूँ। तो बच्चे का दिल सिर्फ माँ के दूध से भरता है। तो बहुत अच्छा काम कर रहे हैं। 6 मंथ्स पे ग्रेजुअली टॉप में जो खाने की चीजें होती है, घर में जो भी बनता है, थोड़ा थोड़ा देंगे, बट हाँ बिल्कुल अपना ब्रेस्ट फीड कंटिन्यू रखें।
Thank you, ma'am. So it is not only about feeding the baby; it is about the satisfaction that baby is getting, the satisfaction the mother is getting, and the whole family is getting that pleasure and that satisfaction and that happiness. So with this, I want to thank Dr. Anu ma'am and Miss Sarita, Miss Sonia, कि उन्होंने अपना एक्सपीरियंस शेयर किया और ब्रेस्ट फीडिंग के बारे में हमें अपनी जानकारी दी।
Any question from the audience? Our students
Any question from the audience
You can
or
also
online
talk to the
participants?
panel.
I'll just read it out.
Online.
In my family, elderly primary Canada mother, 43 years, delivered full-term newborn, feed is inadequate. How to tackle these issues? Elderly.
Okay, so elderly mothers are at slightly higher risk of
having feeding issues. It is a normal phenomenon. तो अगर आप इंटेंट करते हैं कि you want to breastfeed your baby, there are some things like you can go ahead and increase your overall water intake. There are some medications also which you can use. You can take help from the nearest nursing professional or lactation counselor for back massaging if you intend to breastfeed. बट अगर आप ये सब कुछ कर चुके हैं फिर भी मिल्क नहीं आ रहा है,
So then you will have to resort to alternative methods. अंडरस्टैंडिंग कि आपके बच्चे को एक्चुअली इनएडिक्वेसी है. कई बार ये होता है मदर्स को लगता है दूध नहीं आ रहा है, दूध नहीं आ रहा है, मिल्क इज नॉट कमिंग. इट इज ओनली अ परसेप्शन, इट इज नॉट एक्चुअल ब्रेस्ट मिल्क इनसफिशिएंसी. सो प्लीज अगर आपको लग रहा है कि आपका दूध कम आ रहा है पर बच्चे का वजन ठीक चल रहा है तो कोई दिक्कत की बात नहीं है, यू कंटिन्यू टू ब्रेस्ट फीड. But if the baby's weight is also faltering, then you need to consult the nearest person where you have delivered and just take advice regarding some medication, some back massages, relaxation for you, and increasing your water content so that you can produce enough amount of breast milk for your mother, for your baby. But please remember, सिर्फ इसलिए कि आप 43-year-old हैं और आप breastfeed नहीं करा पाएंगे, वो एक myth है. 43-year-old mother can also exclusively breastfeed her child for 6 months. That is there.
So, any more questions from the audience? Yes, ma'am.
I just want to share my own experience. Very good. Very good.
Like I had 4 missed abortions before my first baby. So the time I had my first baby, I was so passionate कि मैं इसका बहुत अच्छे से care करूँगी and I will give exclusive breastfeed. The time I delivered my first child, I was in Chandigarh with my mother. So I was not able to feed. Maybe it was inverted nipples or I don't know what's the reason. And I started crying कि मेरा बच्चा feed क्यों नहीं ले रहा. I was having cesarean section, so she used to sleep. The time she used to come to me, she used to sleep, and I used to cry. I am not able to feed. So mama ने बोला कोई बात नहीं. If she's not taking, we'll give her some top feed. I said no, I will not give top feed. जो मर्जी हो जाए, I will give my own feed. क्योंकि मैंने इस बच्चे की कितनी देर से वेट कर लिया. मैं लेबर रूम में रो के जाती थी. कभी मैं अपना बच्चा लेके जाऊंगी यहाँ से. I used to cry the time I had my 4 missed abortion. तो मैंने बोला कुछ भी हो जाए मैं इसको कोई प्रॉफिट नहीं दूंगी, मैं इसको अपनी फीड दूंगी. आई यूज्ड टू एक्सप्रेस माय मिल्क. मेरे को इतना पेन होता था सिजेरियन के बाद. मैंने एक दिन पूरा अपना फीड एक्सप्रेस करके मतलब मैं हर आधे घंटे में ट्राई करती थी कि शी स्टार्ट टेकिंग माय मिल्क, पर वो जैसे ही मैं लेती थी वो सो जाती थी. तो मुझे और डिसहार्टन फील होता था एंड नोबडी हेल्प मी दैट टाइम. हॉस्पिटल में, प्राइवेट हॉस्पिटल में भी किसी ने मेरी हेल्प नहीं करी वहां पे. पर मेरे को इतना था कि नहीं, इसको मैंने जो मर्जी हो जाए मैं अपना फीड ही दूंगी एंड आई विल ट्राई विद माय ओन ब्रेस्ट. After one day, I was able to succeed and she started taking, and I said, thank God that. And 6 months तक मैंने 6 months में 1.5 year तक मैंने अपने बच्चे को फीड किया. And after 6 months I started weaning. पर मैंने टॉप फीड नहीं दिया. मेरी मम्मा ने बोला क्योंकि कोई बात नहीं, she is maybe having gas pain or something, give her जन्म घुट्टी. मैंने बोला कुछ नहीं दूंगी, I will give my own feed. I was so determined and I thought कि I will take best care of my child. So bitter experience earlier the time I had my missed abortions. Thank you, ma'am. Thank you for sharing your experience. So, as it is rightly said, that breastfeeding is a mother's gift to her baby, and also to the earth, as Dr. Anu also mentioned in her address.
I have
So,
one question
yes, ma'am.
to the twin mother. As you were telling, when you're away, your family members are managing with one top feed, no? When
Yes,
you were
ma'am.
not, when you're not there at home. So how your babies are responding after taking the top feed? Are they still able to attach to the breast,
Yes, ma'am.
or they want the artificial feed? What is their liking?
Because this top feeding was started just I think few days back only, like because I was on vacation, so till the time exclusive. So during when the classes were going on, sometimes at a stretch 3 hours, 4 hours, so it was a bit difficult. Like babies would be hungry and crying. So give one top feed. When then once I came back home during the break, and there was no issue, like because my breast will be full, very tight, so it will be leaking also. So once I attached them to the nipple, like they had no issue. They were not rejecting or anything like that. Yes.
Because the top feeds will have more sugar content and they get easily, they need not work on sucking. So whether they want top feed or breastfeeding, because the baby also learns easy way of getting the milk,
Yes.
no?
Yes. Yes.
So they want to, they may not again get attached to the
Yes.
breast. So any difference was
Uh-huh.
there?
It happened with my cousin sister actually, because she had issues, complication after delivery, so she could not breastfeed properly. It was cesarean. So I think for the first few weeks they have been given top feed. So once they plan to breastfeed the baby was feeling not wanting to put that effort in sucking the mother's breast because with the bottle feeding, it was so easy for the baby. Actually, that experience was from my cousin. I have seen her struggling to breastfeed her baby after initiating top feeding. Yes.
And one more question, any one of you can answer. What was the cultural influence on your diet? Where they, because usually the elders say you eat this, that this will increase the milk. You don't eat it, that the baby will develop diarrhea. So they restrict certain foods and they encourage some foods. So any that kind of experience, was there any food restriction?
So I want to answer. So in that aspect, my family was good. Matlab, in the hospital, education was given that mother should be given high protein diet, lot of milk or water should be given to the mother. So they understand, and a very good diet was given to me. But in the Indian society, like we can see that there are lots of diet issues to the postpartum mother. There are lots of restriction to the mother that water should not be given to the mother in a plenty of water should not be given, and mother in the postpartum unit used to feel that thing that lots of restrictions, diet restrictions are there. So regarding that, health education of the family members should be given to the.
Yes, so that takes a priority. I mean, papaya should not be given, bhindi should not be given, and shatavari should be given, and water should not be
Water
given
should
plain.
not-
You put lots of that black cardamom and you put zira, and then you make the water drink. I mean, we all are educated people. Spread this education, educate the family members while you're educating the mothers, and then I mean, I think women should be smart now. So smart in the sense that okay, we will not eat, but then behind the table, nobody's coming and seeing you in the room what you're eating and what you're not eating. So eat whatever you want. So as far as we are concerned as mothers, we are concerned as educationists, we are concerned as neonatologists, you don't have to tell everything to everyone. And this I can speak for everybody. Don't have to tell everything to everyone, damn it. You're a human being, you're an individual first, even before being a mother. Eat whatever you want. It starts from juices to fruits to non-vegetarian fruit. If you're non-vegetarian, egg, any kind of fruit, any kind of vegetable, no food fats, please. Obviously, avoid large amount of ghee. You don't want to feel bloated at the end of the day. Any green leaf vegetable, any non-vegetarian food, please go ahead and eat it. And don't have to tell everybody that whatever you are eating. Nobody will come and see into your plate what you are eating. It's okay. Be chill. So breastfeeding is an art. Yes, it requires help from our family, from our family members, from our partners, and everything. But everybody, every lady is an individual. First, respect your individuality and eat whatever you want. Please.
One more question to did you practice kangaroo mother care? Because when we practice kangaroo mother care, they say neurological maturity is earlier and sucking reflex will come back quicker. So did you practice kangaroo mother care when the baby was in the NICU and subsequently at home?
Yes, ma'am. We did it on Nicu and followed it on when we were in private ward there also, and after going home, there also we were doing that. Me and my husband, both of us are doing.
So how many hours you did that?
In Nicu, it is strict that it should be 10 hours. We were strictly following that. And after that,
Yeah, so she's right. So in Nicu, actually, there is a competition between the mothers. So minimum target is 2 digits. So when they are doing 8 hours, we tell them, okay, the best way is mother cannot do 10 hours. She has a cesarean. How can she sit? Rope in the grandmother, rope in the grandfather, rope in the father. But together as a unit, each baby needs to get 10 hours. That 2 digit is the target. So some mothers do get tired. They say we cannot do. It's okay. But after 5 days, 7 days, when they start improving, they see, अरे उस बच्चे को तो 16 hours हुए हैं. I need to do. So then that comes as a like a journey together. So mothers compete with each other, and in twins, what we prefer is the mother can actually take both the babies together. So it actually 2 hours for each baby, right? So you don't have to do it for 20 hours. You do it for 10 hours, but then 10 hours each baby gets. So that is the advantage for twins.
I have
Did
one
any of-
question. Like my sister's baby, she was born, I mean, normal vaginal delivery, and so from the first day she started eating parathas of the mess. So my mother used to like, I mean, they used to fight with each other. She said that don't eat parathas. She said nothing matters. I will eat parathas. Please GI doctors don't tell me not to eat paratha, so I will eat parathas. So what paratha is something, what, like my mother was so strong, no, you shouldn't eat parathas.
See, for the initial thing after cesarean or after normal delivery, what the doctors would say is let the mother pass the first stool. So after that, I mean, till that time they say कि थोड़ा सा हल्का खा लीजिए, semi solid or maybe something which can be easily digested. After that, eat paranthas or eat anything, nothing, no food fats.
gas forming foods that like family member they tell you should avoid this.
हाँ, तो उनके साथ भी मत खाओ. Don't eat in front of them.
Share my experience also. Like my family belong to Haryana. All the, like Suman said, there are certain inhibitions. Don't eat this thing or that thing. But you have to be like Dr. Anu said, na, you have to be smart enough and you have to take stand for yourself as an individual. I strictly refused. I will not take this, and whatever I want, I will take, whether you like it or don't like. So I took whatever fruits, vegetables, milk, whatever. And regarding breastfeeding, I just want to share. First child, I didn't face many problems, but my second child really it was very problematic for me. I started breastfeeding within 1 hour itself. Both were normal vaginal deliveries, and then whatever time like I used to continue. I don't want to start with any top feed anything. But the problem was the baby developed physiological jaundice, and after that, some other skin problems also, and he was not gaining the weight. You can imagine at 28 days, the weight was not up to the birth weight also. So really, it was like I don't want to start top feed, but I just consulted the pediatricians, and ultimately I have to start. I
Which
was
is
not
okay. Please, I mean, though it's a moral duty, don't feel guilty of having not been able to breastfeed your baby. It is the norm. We all want to breastfeed. There is a difference between desire and if the baby is not gaining weight, please don't feel guilty कि मैंने breastfeed नहीं करा. You're not a criminal. It is your duty. It is your dereliction. You want to breastfeed. The intent
the
is
baby
there.
was not gaining the weight.
Yes.
I was trying my best, and they started some medicines also to me. I was taking those that,
So
and
once
dietary issues
everything has
also
been
not
tried,
so. Whatever I was taking proper diet also, but I have to start because
which
the
is okay.
birth
Don't
weight
feel
was
like a
very
criminal
less
if you're not
at
able to
28
breastfeed.
days. So that was the. And regarding diet, so you have to be strong enough. You have to convince your family members.
Is there online? Priya Kumari is asking 90% of primary mothers are having psychological feeling of feed inadequacy, meaning baby is continuously crying, didn't sleep at night. So, what kind of measures can be taken to solve this issue?
So there are multiple causes of crying. It could be a wet nappy, or baby's nose may be blocked, or it's just that the baby wants to play, baby doesn't want to sleep, and you're pushing the baby to sleep. So check for all these issues. Every time the baby crying does not mean the baby is hungry. That is the first thing. The second thing is that even babies crying and babies pooing, they stimulate breast milk production. तो अगर बच्चा रो रहा है, थोड़ा सा रो रहा है, कोई बात नहीं, रोने दो. If the family member से इतना बार बार होता रहता है, आप कुछ करते क्यों नहीं हो? So just tell them, please stand away. It is very normal for my baby to cry. While passing stool, while passing urine, with a wet nappy, with a nose block, baby will cry. Why should a baby not cry? That is the way that he's expressing his feelings. So crying is not synonymous with कि मुझे भूख लगी. Number one. Number two, find out all the causes of crying. Even then, if you feel that you're not getting that amount of milk, keep on latching the baby in the initial few days. The more is the stimulus from sucking, better will be your milk production. It's like a cycle. Baby's crying stimulates breast milk production. Baby's touch, baby's smell, baby's sucking on the breast stimulates breast milk production. So keep the baby to the breast, let the baby suck for as long as the baby wants. If the baby is gaining weight and the baby is passing good amount of urine, don't worry. Even if the baby is crying once or twice or even 4 times or 10 times a day, it's normal. That is the way they express their feeling. That is it.
Thank you, ma'am. Thank you for answering all our queries. Any more queries?
Ma'am, I want to tell one thing that was very much helpful, because in the early period, baby circadian cycle is not fixed for the babies. So when I try to provide a dark period for my babies, after 10 o'clock, I used to switch off the light, and that helped me a lot. मतलब, the cycle was settled after it will take around 15 days. The 15 days was very difficult period because baby was not knowing when it is night, when it is day. So used to switch off the light after 10 o'clock, and that was a dark period. And at the time, baby understand that at this time I should sleep and I should take rest. And after 6 o'clock, and when it was noises, and then baby
The
used
baby
to
would understand. As I said, baby understands the
and
mother very well. So I have a small experience from my own self. My elder one was a night waker. So entire night she used to howl and cry. I didn't understand the reason till date why she's crying. Feeding, again lying on the bed crying, feeding, again lying on the bed and crying. So I was very particular when my second daughter was born that I'm not going to allow her to be awake in the night. I didn't have to do anything. Actually, the elder one was dancing and howling throughout the day. So the younger one was automatically awake throughout the day. So in the night, both of them used to go to sleep. Exactly at 11 o'clock, both of them will sleep. And the younger one would not get up till 4 o'clock. So it was like a experience in myself. So elder one, I did everything, but baby was not ready to sleep in the night. Younger one, I did nothing, but the elder one did everything. So three of us were sleeping. So babies decide what they want to do. We just have to be with them.
One thing too, Manju, you were telling that your baby is on your breast throughout the night. What about aspiration? Were you worried? Because we don't encourage sleeping and feeding, no, at any time.
Actually, once he aspirated also, and he was admitted here with under life-threatening some kind of diagnosis. He was under evaluation, but all the tests which doctor mentioned, he was not ready. I mean, he won't take any test. A simple ECG also could not be done. So we requested doctor, and we took discharge. And it was initial period only in second month or maybe. And then we brought some, doctor said that some propped up chair, and whole night we used to take duties, me, my husband and my niece, and we used to see him. So that's how we managed. But now as such, no aspiration issue, thankfully.
He learned the art.
So maybe head end a little up and the mother's arm below the baby, so that the head end is a little up. Things don't. There is no problem.
They're also in my experience, I have seen mothers sleeping over the baby.
Yes.
And there were caught deaths where we lost the baby. Also.
Yes, there was a
So
news
sleeping
also
and
at that time.
feeding is not really encouraged, especially during the initial.
During the
period.
initial
After
6
cesarean, mother
months,
will
I
be
could not.
sedated.
Actually, during the initial 6 months or up to 1 year, I had to sit and feed. I could not lie, and I didn't know how to feed baby while I am lying. I couldn't do it at all. So after 1 year only, when my back and this bilateral hip and knee are diagnosed with some issue, then only I'm doing sideline
For
feeding to
older
baby.
babies, it is okay.
Yeah,
Newborn, it is
younger babies, the mother has to be awake. Baby may still be sleeping, tickle the baby and put the baby to the breast, but mother has to be awake while breastfeeding.
Yes.
Thank you, ma'am. Thank you, everyone. So now we are wrapping up this informative session, and this is really interesting and informative session for all of us. Thank you, ma'am. And also, I would like to give special thanks to Dr. Anu as she has enlightened us with her words. So now I request Ms. Rachel and Ms. Ma'am Monica that she will continue the program further. Thank you. So first of all, a very big thank you to the participants of this focus group discussion. Can we give them a big hand of applause? It was a very much a heart-to-heart, genuinely heart-to-heart conversation, and a very, heartfelt thanks to Dr. Anu for leading such a wonderful session, and also my thanks to the moderators of this discussion. Before we move on to the next, I would like to invite Anu ma'am and Lata ma'am to felicitate the participants with a token of love.
Not crying, no, very cooperative. Cry at
Ma'am, please. Yes.
Madam Marina.
You can come.
Camera.
Thank you for sharing your experience.
Madam Suma. Madam Sarita. Madam Sonia. Sonia ji. Dr. Manju.
Thank you so much. For sharing your Thank you, Manju.
Thank you, ma'am. We also had the poster competition organized by the College of Nursing for our nursing students. There were a few participants, and we had good posters made by mesmerizing ones, made by a few of you. And I would like to announce the prizes. The second prize goes to Swati, fourth year BSc nursing student. I would like to ask Lata ma'am to hand over the prize. Somebody can come for her.
Where is Swati? You can
The first prize goes to Rituparna. Someone can collect it for Rituparna.
Okay. Are they online? No, they could have joined online on this.
Thank you so much, ma'am.
Okay, now when we are commencing towards the end of this very enlightening, touchy, and informative morning, I would like Ms. Levis Murray to please come on stage and deliver a vote of thanks.
Very good morning to you all. It is my immense pleasure to deliver the word of thanks on this wonderful event. I'm really grateful to the AIIMS administration for allowing us to have this program, for the logistical support. Um, I'm thankful to to our principal, ma'am. She's the visionary behind all our programs, and for the enthusiastic support and all the small um, advices that she gives to make this program such a huge success. I'm very grateful to Dr. Anu for having come here and for the keynote address, which was very informative, and for also leading the panel discussion in such a wonderful way. I'm really thankful to the participants of the panel discussion, Dr. Manju, Ms. Sarita, Ms. Sonia, Ms. Suman, and Ms. Marina for opening their hearts to us. It's very difficult to do that in front of people, but you have done it, and it's for the learning and for the experience that you have shared, which will really motivate the youngsters, especially. So I'm extremely thankful to each one of them. I'm thankful to the MSc nursing students also, Pritika and Deepika, Richi, Ram Gopal, for managing the program in doing the responsibilities really well. I'm thankful to the organizing team, Cecilia, Suman, Sri Sumati, and well, Sister Rachel, Manita, for doing all the work behind the screen. Um, Thank you so much. I'm thankful for the set facility team. Mrs. Susan is always there. He's supporting us every time, going beyond his duty also in making sure that there's no technical glitches, and all the other staff of the set facility. Yeah, and last but not the least, thank you to all the participants offline and online. Thank you.
Please join us for fitness. Please join us for thank you so much.
Yeah.